Hello everyone, this is your pharmacist, and the topic today we are going to discuss is gastroesophageal reflux disease, which is also abbreviated as GERD. So the medical term for GERD is heartburn. It is said that 10% of people in the US get heartburn every week. How it is characterized by? It is characterized by burning sensation in the gut or chest and then radiating to the neck. You will feel a burning or a warm sensation first in the stomach or gut, and then you can also feel it in the chest and then radiating to the neck. What happens in the GERD? In GERD, the lower esophageal sphincters, they allow stomach contents to move up into the esophagus, where acidic tissues can cause the tissue damage and pain. So first, it is a medical term. The medical term for gastroesophageal reflux disease is heartburn, and 10% of people in US get heartburn every week. How it is characterized by? It is characterized by burning sensation in the gut or chest and then radiating to the neck. In gastroesophageal reflux disease, the lower esophageal sphincters, they allow the stomach contents to move up into the esophagus, where the acidic tissues, they can cause the tissue damage and pain. So the main is acidity. So the acidity, it will cause the tissue damage and it will cause the pain. Now let's see what are the causes of GERD. It is caused by faulty lower esophageal sphincter that doesn't close properly. It means that the lower sphincter of esophagus, it doesn't close properly. It doesn't, there is a hole, there is a lining in which there is closeness of the sphincter, but it is not closed properly. It seems like it is closed, but it is not closed. So when it is not closed, then the content of food, it goes up to the neck and it will destroy the lining of the sphincter. Spicy, fatty foods, caffeine, smoking and drinking alcohol, they will decrease the closing pressure of the sphincter. So when you are having spicy foods, fatty foods, caffeine, chocolate, smoking, drinking alcohol, it will decrease the closing pressure. There must be enough closing pressure that will close the sphincter. But when you are having such type of foods and you are eating before the bedtime, you have wrong habits, then that will affect the closeness, the closing pressure of the sphincter. Large meals and obesity will increase the pressure in the stomach and it will force its contents up into the esophagus. There is also a factor that if you are having large meals and obesity, which is a factor in increasing the pressure in the stomach and for its contents up to the esophagus. So what precautions are needed to relieve GERD? You have to lose your weight. You have to elevate the head of the bed at night. Remain upright, like a straight position after meal. Reduce your meal portion. Decrease alcohol and tobacco use. So weight loss, elevate the head of the bed at night. Remaining upright after meal. Reducing meal size. Decreasing alcohol and tobacco use. Long-term exposure, that is linked to narrowing of the esophagus and esophageal cancer. So if you have long-term exposure of the heartburn and the increased pressure of the sphincter, then it will lead to narrowing of the esophagus. Your esophagus will narrow and it will lead to esophageal cancer. So the resolution, if you want to have a long-term resolution, so it is to reduce the acidity of the stomach. So you need to have such medicines that will entirely reduce the acid in your stomach. And if you have long-term exposure, then you need to have less effect or damage to the esophagus. Treat your mild to moderate GERD. How they will treat? Because they contain special ions that react with hydrogen ions in the stomach, and they will neutralize that acid. It is effective only for a few hours, and you need to take this antacid after every meal, not before, but after every meal you need to take your antacid. These are the drugs that are used to treat gastroesophageal reflux disease. Number one is aluminium hydroxide, which is also known as Gaviscon. Then aluminium hydroxide or magnesium hydroxide by the brand name Malox and Malenta. Calcium carbonate by the brand name Malox and Tums. Calcium carbonate and magnesium hydroxide, the brand name is Malenta and Rolaids. So what are the drug names? Aluminium hydroxide, there is a combination of aluminium hydroxide and magnesium hydroxide. Calcium carbonate alone, and then in combination with magnesium hydroxide, the brand name is Rolaids. The side effect of antacids: constipation, diarrhea, stomach pain, nausea, vomiting, because they are affecting your stomach, your esophagus. Then the most common side effects that are related with antacids will be constipation, diarrhea, stomach pain, nausea, vomiting. Calcium and aluminium containing antacids, they will cause constipation. You can remember it, but the calcium starts with C and constipation starts with C. So calcium and aluminium, they containing antacids, they will cause constipation, and magnesium containing antacids, they will cause diarrhea. So it's a mnemonic, like I want you to remember that calcium and aluminium will cause constipation, but magnesium, it is very soft. Magnesium, so it will, diarrhea is also soft and watery. So magnesium contain antacids and it will cause diarrhea. So it is a mnemonic, and you need to remember, you cannot have constipation with magnesium containing antacids. Now comes to the contraindications. If you are having antacids with the tetracycline, quinolones and isoniazid, then keep in mind that these antacids will decrease the absorption of tetracyclines, isoniazid and quinolones. So they should not be given at the same time as antacids. If you are having antacids at 4 o'clock, then have tetracycline, quinolones and isoniazids at 2 o'clock. So it should not be given at the same time because they will decrease the absorption of these drugs. And antacid can also interact with the ferrous sulfate in iron and sulfonylureas, that is a medication for diabetes patients. So there is interaction with these drugs also. So antacid should be taken before or after 2 hours of these medications. There is a caution in renal failure patients, because if you are having antacids, for example aluminium and magnesium, these can accumulate in the blood if you have a renal failure. So those patients who are having renal failure, they need to tell your doctor, and the doctors must examine the patient before giving such antacids. Antacid suspensions, they need to be shaken well before consuming it. So there is a very common thing that if you're having suspension, if you're having emulsion, if you're having solution of whatever medicine it is, in here it is antacid, so they need to be shaken well to homogenize the contents, to keep the contents in a homogeneous condition. Your contents will be mixed properly, and then you can have that suspension after mixing it. So there is a label that comes with such antacids as well. So this is the end of the heartburn. I have discussed only one first primary choice of therapy. We call it like treatment of choice, like antacids. There are PPIs, there are other medicines as well. I will discuss those medications or those choice of treatment in my next video. So like, share and subscribe until then for more medicine information. I hope we have summarized well GERD.